Greetings, everyone. So, this is the recall session for pharmacology for the 12th Jan examination. I know this is coming a bit late, but the whole motive of this session is to help the upcoming batches to know the topics that were actually tested in this exam. Now, a disclaimer before I begin. By no means I'm saying that the exact same language, exact same options were asked in the exam. I'm sure, they were much more difficult, and definitely when we are sitting in the exam hall, the pressure is much more. So even simpler questions may seem more difficult. And when it comes to pharmacology, I can say that like a bit of questions were straightforward, direct, and there were some questions which were definitely integrated, etc. Okay, I've always been telling you be mentally prepared, especially for pharmacology. There will be integrations that will be happening because the treatments of all subjects is nothing but pharma. And one humble request to all of you, please, if you remember any option or few words about the sentences that were used in the framing of the questions, please do help us compile those questions by writing them in the comments. This is the thing we are going to do, obviously, for the future students. See, we were able to tell you some things that this topic is more important, etc., because of the seniors who helped us, right? They told that this question came in your exam, so we were able to help you. Now it's your turn to do the same for your juniors. And before I begin, thank you all of the people who have helped me compile this by sending me all the messages, etc. All right, my friends. So let us begin now. Which of the following anti-diabetic drugs is preferred in the management of the patient with heart and renal disease? Okay, so they have given two hints. The patient is having heart diseases as well as renal diseases. So the most appropriate answer that we should actually go for in this situation, it is going to be none other than SGLT2 inhibitors. Okay, they become our best answer, the drugs which we call by the name of gliflozins. So gliflozins are the best medicines when it comes to patients having heart diseases, diabetes, etc., as well as renal disease. Now coming to the next question, which of the following anti-diabetic drug is used in the patient having obesity and renal failure? See, I'm not sure if this was just one question in which obesity word also was given and they asked this question, or is it a separate question? Because many people told me like there were two separate questions on diabetes as well, one with the heart disease and diabetes and the second one with obesity and diabetes. So now if this is the situation, which is the correct answer? Still, even in this also, the correct answer is going to be gliflozins, doctor. Why? Because let's look at the other option. Glipizide is a sulfonylurea, and sulfonylurea causes weight gain. The person is already obese. Now, if you see rosiglitazone, that can also cause weight gain. Metformin cannot be used in renal failure patients. So that's it. That's the reason I cannot use the first three options. So, I'm automatically left off with the last option, that is gliflozin drugs. So if you look here, just in my last 25 important question series, I had given you this expected question, and pretty much on the same lines, you can see the question has come. In this clinical case, we have learned that the patient is having diabetes and heart failure. What is the best medicine to be used? Gliflozins. And as you can see, this question has come. In my other previous 25 important question series, this is another flowchart that I had given you, in which we have learned that there are some drugs that can induce weight loss. For example, GLP-1 or SGLT2. I said remember at least number 1, number 2, like that, GLP-1 and SGLT2. So that is just the reference for the first two questions, thankfully, from the topics that we have discussed. I'm no way claiming that the exact question was there or anything. Guys, the whole motto of this is to make the people understand who are taking this exam that whatever we are putting through in the important questions, read that topic well. I can't say exact ditto same question will come. See, we were lucky in few questions, that's a different case. But otherwise, read those topics well because those are anticipated topics in the exam. Next question, a person who went for a trek developed mountain sickness. Which part of the nephron does the drug used in the treatment works on? So basically, they have given a case situation, I guess, related to mountain sickness. We all know the medicine that we use in the mountain sickness. It's a drug by the name of acetazolamide, which comes under a class called carbonic anhydrase inhibitors, right? This is the class of the drug. Fine. Now, where do carbonic anhydrase inhibitors work? The correct answer is none other than PCT. Okay. So PCT is the area. See, they did not give the options. I believe you had to choose something that was given in the image like ABCD. So PCT will be this area, as you can see. This one is loop of Henle, this one is the DCT, and this area would be the collecting duct. So 4 different areas that were given, and I'm sure most of you chose this answer correctly. So pretty anticipated question, acetazolamide. Okay, this is that medicine. Again, lucky we can say. You can see exactly in the last series, there was a question on the diuretics and the site of action where they work. Okay, you can see acetazolamide, we even striked off the wrong option and I told you it works in the PCT. All right, so at least 2 questions or 3 questions we can say pretty much from this series right here. So question number 4. A patient undergoing a surgery is administered succinylcholine, following which the patient develops a higher body temperature, tremors, and muscle rigidity. What is the most appropriate management of this patient? So guys, number 1, we need to pick up the hints and make a diagnosis. They're telling us some temperature, some drug was given, and now they're asking us the treatment of this situation. First, you need to make the diagnosis of this situation, which is nothing but malignant hyperthermia. This is the diagnosis that you need to make. Now, you must know that malignant hyperthermia can be caused by certain drugs as a side effect. Okay, so what are these drugs? Now, if you talk about muscle relaxants, okay, muscle relaxants, the most common drug who can actually do this is the option that was given to us, and this drug is called succinylcholine. All right. Now, other drugs, if you talk about from the inhalational agents that we use in anesthesia, the most common drug who can do this, it is actually halothane. Although other inhalational agents can also do this, but the most common one would be this one. And even local anesthetics can do that to certain extents. For example, lidocaine. Usually exam point of view, they might use halothane or succinylcholine. Now, what is the treatment that we need to give for this situation? It is going to be a drug by the name of dantrolene. Okay. So here you go, my friends. You can see pretty much a case scenario that I have made and I have given you in my 25 important question series. I have used the drug halothane and I gave that diagnosis malignant hyperthermia you had to make. And then I asked you the treatment, exactly same question. Lucky enough, same thing came up. All right. And I was folding my hands and telling you, please watch this series and go. Some questions at least, may come. Next question, which of the following antihypertensives are contraindicated in pregnancy? I'm sure there were more lines that must have been given in this question, just as, deviations. But the main essence of the question was to ask you which drugs is not used in pregnancy when it comes to hypertension. Okay, I believe everybody must have answered this correctly. The answer is lisinopril. ACE inhibitors or ARBs, they are absolutely contraindicated in pregnancy. So a very common thing that we have discussed, that ACEs or ARBs in the topic of hypertension are contraindicated because they are associated with renal agenesis. And the safer drugs which are used, pretty much I believe they were given in the other options. Okay. So that's why it's a humble request to all of you, whoever is going to take this exam and watching this right now, please go through all this 25 important question series. We as faculties put a lot of effort to help you guys so that you clear this exam more easily. Recent test and discussion series that we have conducted, even in that also pretty much same simple line question which is not used in pregnancy, that is ACEs or ARBs. This question I had given you guys. Next is, which of the adverse effects of bleomycin is exaggerated by the radiation exposure? So anti-cancer drug called bleomycin, they're just asking what side effect can actually increase: neural, pulmonary, cardiac, or hepatic. The correct answer to this would be pulmonary, because bleomycin, if you all remember, it is associated with a side effect called pulmonary fibrosis. Okay, I told you, imagine something to do with lungs, it becomes difficult to blow. So again, something discussed for the last minute review. As you can see, pulmonary fibrosis. It's a very small list that I have made for the side effect of anti-cancers. And in the previous exams also, question have come from this small table. So definitely make sure you revise this. Bleomycin we have talked about may cause pulmonary fibrosis. Seventh question, a 5-year-old child was brought to emergency department after 6 hours after consuming 5 tablets of paracetamol. The child weighs 10 kilos. What is the likely situation in this patient right now? So I told you paracetamol toxicity, especially the antidote or something, will be asked in exam, quite a common question. So they're just asking you, a child has consumed 5 tablets of PCM. So if we assume 500 mg into 5 tablets, totally it becomes 2500 mg or 2.5 gram. Now, what you guys need to remember is, here the dose that was consumed by the patient is 2500 mg or 2.5 gram. But the more dangerous dose is 10 grams and above. Okay. So anyway, let's look at the thing, what we can expect. Can I expect fulminant hepatitis at a low dose? The answer is not really. So this option I can rule out. Severe symptoms at a low dose, again, not really. This also I can rule out. So I don't know what was the other option that was given, but I would have chosen this as the answer. Increase in the liver enzymes would be correct. Okay. We all know paracetamol is a hepatotoxic drug. This may be causing some damage to the liver, increasing the liver enzymes. Next question, another one on paracetamol. What is the mechanism of antidote given in the paracetamol toxicity? Now, if you see the 4 options, it reduces one bad metabolite called NAPQI, and this will actually start increasing glutathione levels, which will reduce the oxidative stress. If you see the second option, it's given it increases free radicals or it increases oxidative stress, which would be a wrong answer, right? So that's why it reduces NAPQI or it increases glutathione, whatever must have been given in option. That's the correct answer for this. Again, last minute review things. You can see we had discussed this. Paracetamol increases one bad guy called as NAPQI. And when you give an antidote called NAC, that is N-acetylcysteine, it reduces NAPQI, which in return increases glutathione, right? Replenishes means it increases the glutathione back again, and this will reduce the oxidative stress. A patient has visual acuity defects after consuming a drink. What could be the possible substance causing the problem? Okay. So after drinking something, visual problems. Now, we as doctors must keep certain things at our fingertips like this. If they're giving you this situation, please remember it is none other than alcohol. The patient must have consumed alcohol, because of which there is some damage to the eye. Now, there are 2 alcohols. One is methanol, another is ethanol. Remember, we have said that methanol is the bad guy. That's the bad guy. So what is the story of methanol? When you drink methanol, it converts to a substance called as formaldehyde. Formaldehyde by one enzyme called alcohol dehydrogenase. Next, this formaldehyde converts to something called formic acid, and you must remember this is happening by an enzyme called formaldehyde dehydrogenase. Now, when you consume methanol, it's not methanol directly that is damaging your body. It is the byproducts that are damaging your body. Okay. Now, the most dangerous byproduct from this is formic acid. I told you during our sessions that formic acid is the one that causes death as well as it makes you blind as well. Okay, optic neuritis can be caused by something called as formic acid. So basically, the question was asking what is the substance that is causing this issue? Then the correct answer, in my opinion, would be formic acid. Now, looking at the next question, question number 10, a 30-year-old male undergoing treatment of seizure having gum hypertrophy and vitamin B12 deficiency. Which of the following might be the patient on? So, doctors, there are some hints that are given here. There is deficiency of B12, maybe after using the drug. Next, the patient is undergoing treatment of seizure, anti-epileptics. That means some side effects are very particular from that topic that you all got to know. And by now, you must have guessed the correct answer to this is going to be a drug called phenytoin. Okay. Now, phenytoin has a lot of side effects. In fact, I told you it will be asked only for its side effect rather than its use. Again, a question that I had given in the previous TND, because I told you the questions also what we give in this are very important, those topics. So hair growth, meaning hirsutism, gum hyperplasia, etc., reduction in certain vitamins like K, vitamin D, vitamin B12. These are all the things that we can expect with phenytoin drug. Okay. A psychotic patient was started on a medicine called olanzapine. So olanzapine therapy. Olanzapine carries maximum risk of which of the following adverse effects? They're simply asking us which side effect risk is highest with the medicine called olanzapine. So here the correct answer will be weight gain, because the first two side effects, that is agranulocytosis or wet pillow syndrome, if they were given in options, they are caused by clozapine. Tardive dyskinesia, it is actually one of the extrapyramidal side effects which can be caused by all antipsychotic drugs. High potency drugs have higher risk of causing this side effect called tardive dyskinesia or EPS in general. So again, that is something dicey that I will not choose. Weight gain is a very common side effect of olanzapine. Olanzapine में O याद रखना होता है, O for obesity. Okay, O for obesity. This is a side effect of olanzapine. And there are some drugs, if you use, there is no weight gain with them, aripiprazole, etc. Next, the instruction given to sit upright after administering a drug called zoledronate is to prevent which adverse effect? Okay, so they're simply asking us, why do we ask patient to sit straight for some time after taking the drug zoledronate? So first of all, what is zoledronate? It is a drug that belongs to a class called as bisphosphonates, the medicines which are generally considered the drug of choice for treating osteoporosis. Okay, now the side effect of using these drugs is esophagitis. If you remember in the notes, we specifically wrote you should sit at least 30 minutes upright after taking this drug to prevent the risk of esophagitis. And I told you how to remember this. This drug is having 8 in the name. 8 means it's an acid. You can assume when you take this drug, it irritates your esophagus, causing esophagitis. That's why sit straight, drink more water so that the drug can get flushed from this area. Next question, in OP poisoning, which of the effects cannot be reversed by atropine? Now, first of all, you must remember what is happening in OP poisoning. So, in the OP poisoning, there is excess parasympathetic activity that is happening because of too much increase in acetylcholine levels. So, how does this happen? This increase in acetylcholine, muscarinic activity increases parasympathetic action. And you know, in my classes, I teach you parasympathetic activity by a term called as dumbbells. Meaning what will happen in OP poisoning is dumbbells will increase. Next, we also learned that there is one more receptor on which this drug works, NM receptor. And on the NM receptor, when there is an action, initially there will be contractions of muscles leading to tremors, but later, due to receptor desensitization, there is muscle relaxation, skeletal muscle relaxation that will happen, and this leads to muscle weakness or lethargy. Now, majority of the symptoms in this disease, they come by muscarinic receptor. So what we do is we give a drug that blocks muscarinic receptor. If you block muscarinic receptor only by the drug called atropine, which effect will still persist? The answer is lethargy, because atropine does not work on nicotinic receptor, it only works on muscarinic receptor. So in this options, if you notice, which option seems the best option? Muscle weakness. This cannot be reversed. And this concept I have explained just in my last 25 important question series. You can see I was talking about why the stigmine drugs, you add atropine when you're treating myasthenia, etc. So anyway, this exact concept I explained to you, the reason we are blocking muscarinic receptor by giving atropine. OP poisoning to farmer ka case, we have said so many times that we can expect that in the exam. So guys, question number 14, resistance to which of the following ATT is associated with CAT-G gene mutation? So let's go. The correct answer to this is isoniazid in the drugs called HRZE, the first drug called isoniazid. I've told you there are two genes mutations only that we should keep an eye on, and TB drugs co you have to read properly, because every exam they're asking something or the other. When you know almost short questions are coming from a topic, then we should not lose. Small table is there in our notes, if you notice the side effects, some gene mutations, etc. And especially this time, we said there is a treatment that has come for MDR TB, resistant TB. So that's where resistance type of a question they gave. Isoniazid is actually a pro-drug, meaning it is inactive drug when you take them. To give you anti-tubercular effect, this drug must first get active. And the name of enzyme that activates this, it is simply called by the name of catalase. And this catalase enzyme is coming from the bacteria only, that is TB, by the gene called CAT-G gene. So now what will happen is that if there is a mutation in the CAT-G gene, this catalase enzyme will not be available. If this enzyme is not available, your drug called as isoniazid will not get active, and this eventually can lead to the resistant type of TBs like MDR TB, XDR TB, etc. Next question. A patient was started on ATT and ART, meaning TB treatment and HIV treatment, antiretroviral treatment. 2 months later, the patient experiences fever and respiratory distress. What is the most likely reason for this? The best answer from this would be immunological reaction. So what exactly are we looking at? Let's try to understand. Assume a person was started on ART, that is antiretroviral treatment for HIV. So when you give HAART or ART, whatever you want to call it, the CD4 count of the patient will improve. HIV has kept it less, but now because HIV is dying, the CD4 count will increase. Now what will happen is this immune cells, CD4 count cells, when they see the gentleman called TB in your lungs, they get hyper excited. Now they want to go and kill this TB. While trying to kill TB, they may create some damage in and around. That means if you start HIV treatment without treating TB first, what is happening here? This is going to lead to an immunological reaction. This is known as IRIS. That's why what do we advise is first we should always start ATT should always be started first, TB. So treat TB, kill as much as possible. Then give some gap so that some TB organisms die. At least 2 weeks of gap we should give. And then we can start the treatment of HIV by the thing called HAART, highly active antiretroviral treatment. If you don't do this, then there is a risk of what we call as IRIS, okay, immune reconstitution inflammatory syndrome. Again, TB drugs have come pretty much in all exams in the recent 4 or 5 exams. Mostly the question that they have asked was the side effects, especially the visual side effects with ethambutol. So again, as I'm reminding you, when we are touching some topic here, see, obviously we can't teach you everything like what is MDR-TB, what is its treatment, what is XDR, etc. You have to read those topics well from the main notes. Okay, and if you can see in our main notes, the second line is just mutations only. And there are 2 mutations we had to know. One is this isoniazid, second is RPO-B gene mutation also, that is for rifampicin. Next, a patient presented with fever and nuchal rigidity. Lumbar puncture was performed and the CSF analysis reveals low glucose, 80% neutrophils and protein of whatever value. What is the most appropriate treatment of this patient? Okay, so this is an integrated question. Now, basically from your path, medicine, micro, whatever you call it, you must know how to diagnose meningitis. And meningitis is a very repeated MCQ. Pretty much every exam they put something related to meningitis. Okay. Now, first of all, based on the values that are given in this question, we have to diagnose this as pyogenic meningitis or bacterial meningitis. Now, how exactly do I know that this is bacterial meningitis? Number one, the sugar is low. Okay, low glucose is a feature of bacteria. And you must know neutrophils were given. That's why I would choose this as bacterial meningitis. So if this was given, then according to this question, the best answer will be option number C. See, what all they have given is, one is antiviral, another is TB meningitis also was given. That means based on the diagnosis only, you have to answer this question. It is not TB meningitis, because if it was TB meningitis, instead of neutrophils, lymphocytes would have been found. Okay. If it was viral meningitis, then the glucose would be normal. It will not be less. So by ruling out everything, this is pyogenic meningitis. And for pyogenic meningitis, we use ceftriaxone. Ceftriaxone is more or less like an empirical treatment. It's a very broad spectrum antibiotic which belongs to the 3rd generation cephalosporins. And we have learned the 3rd generation crosses blood-brain barrier, hence they are used in meningitis, especially ceftriaxone. Okay. Now, vancomycin plus or minus would be added to cover for the gram-positive organisms, etc. And even for MRSA, right? Next is, which of the following is incorrect dose in leprosy treatment? So basically they ask the incorrect dose. Now, I was expecting this question would come, but I didn't expect the doses exactly would be given. But anyway, have a look at this. Like we talked about the multibacillary leprosy, that is lepromatous leprosy. It is a severe form of the disease. Or even paucibacillary, that is tuberculoid leprosy. In both of them, the treatment that is given these days is DRC. So how are these 3 drugs given? Okay, there is some revision that has happened in the protocols of treating the leprosy patients. Now, for both leprosy, the treatment is same. Earlier, it was little different, but now it is same drugs, DRC, to be given for mild leprosy also, severe leprosy also. See, when we begin the treatment, first day of the treatment, what I would do is, I'd give you one drug, single drug like this. This is nothing but dapsone. It is 100 mg. So DRC word I'm using, D I used first, so only one drug. R is 2 drugs and C is 3 drugs. Now, what is this two drugs? It is nothing but rifampicin, 300 mg into 2. That means total rifampicin to be taken is how much in the beginning? 600 mg. How much dapsone am I taking in the beginning? 100 mg. And last clofazimine, I am taking 3 tablets if you notice here. 100 mg into 3. So clofazimine I have to take monthly. How much? 300 mg. 300 mg. So this is about monthly ones. As you can see, there is a clean line of distinction between this, and after that you have to take only two drugs. Day 2 onwards you're going to take only two drugs, that is dapsone and clofazimine, which is 100 mg and 50 mg. So that means if you see the dosing numbers in this, I understand it is difficult to remember the doses. If you notice in this, there is no 450. There is either 100, 300 or 50. Or if you see round figures, 300 or 600. There is no 450 in this. That's where we chose the answer as rifampicin 450 mg weekly. This is the wrong thing. Okay. Now, maybe by fluke, or if you have studied this, you got it correct. Well done. Otherwise, it's fine. Next one in the list is treatment of cryptococcal meningitis. Now, the best answer for this would be flucytosine plus amphotericin B. This would be the best combination. It's called induction treatment that we give usually for 2 weeks in the beginning. Combination of flucytosine plus amphotericin B is done. Later, for the maintenance, we can use fluconazole. Now, there was a confusion in this. Many students chose fluconazole also. Which of the statements about platinum compounds is true? You have to remember the correct option is this. Cisplatin is more nephrotoxic than carboplatin. Sir, even if you see our notes, I understand they introduced 4 options just based on 2 drug side effect. If you notice, we have said that cisplatin is highly nephrotoxic and ototoxic. If carboplatin was more nephrotoxic, ototoxic, we would have written that one in the notes. We wrote cisplatin and its antidote also. If you remember amifostin about this nephrotoxicity, etc. So please remember, cisplatin is more nephro-ototoxic compared to carboplatin. In fact, carboplatin is least. Okay. And if you remember, even cisplatin is the most emetogenic drug. And for that, we have even learned how to treat the chemo-induced vomiting. That also we have talked about. Question number 20. A female patient with unilateral headache, throbbing pain and photophobia. She was prescribed sumatriptan. What's the diagnosis? I understand this is not a pharma question, obviously because they're talking diagnosis, etc. But the reason I just included in our list is just to make you understand why I make the questions in such a way where you first need to make a diagnosis. If you see this question also, the throbbing pain, sensitivity to light and sound, all these things, it becomes very important for us to know. Okay, diagnosis of migraine needs to be made. That was the question that they asked, meaning the answer to the previous question I just discussed is migraine. They've even given the patient was treated with sumatriptan, right? What is the mechanism of action of botulinum toxin? Okay, I don't know if the options were this simple. Basically, what this drug does is it blocks the release of acetylcholine, which will make the muscles get relaxed. So that's how Botox relaxes muscles. Hence, we use it in treating some kind of a contraction. Now you can see in this question, basically I had given you this exact question about first case scenario. You had to recognize that this is some disease where we use Botox. And some students told me, sir, we had looked at your rapid revision just before the exam, like 1 day before, and this image was imprinted in our heads and that was asked in the exam. Okay, so bird's beak appearance, this one is achalasia cardia. So I believe that also was an applied question. In the previous question you saw migraine ka diagnosis was asked. That's why please read this. I'm not saying, those are the questions I'm claiming. I'm just telling you that go through this. It will definitely help you in the exam, hopefully. All right. So, Botox, how does it work? The question was that, and it blocks the release of ACH. Next, if they go a little deeper also, I had given this in our recent test and discussion series, that it blocks the release of acetylcholine where presynaptic. Next question, test results of a hypertensive patient shows hypernatremia, hypokalemia, and alkalosis. What is the most likely diagnosis? Okay. Once again, I hope you guys understand. We are not saying this is a pharma question. Why am I including this here? Just if you notice, even earlier also, we had discussed this and we said since there is excess aldosterone in the patient having Conn syndrome, what will happen? There will be hypernatremia that will lead to hypertension. So this is called secondary hypertension because it's happening due to some disease. Then there will be hypokalemia and acid is also lost. That's why the body become alkalotic. What is the problem in this? Too much aldosterone. What do you think I should do? Block aldosterone by a medicine called spironolactone. In a patient after giving NORAD, the patient was noticed to have decreased in the heart rate. What could be the possible reason? Now, this is a thing that we have learned to explain you the side effects. You can check our notes. This is there. Baroreceptor reflex. What is this? Let's have a look. Imagine your blood vessels have undergone vasoconstriction. Now, vasoconstriction increases BP. Now, the heart will get a message because of the baroreceptors. And what does the heart try to do? Compensate. Right now, BP is more. What do you think compensation means? Reduce the BP. So, the BP goes down by reducing the heart rate. This is called reflex bradycardia. The heart rate is reducing. Okay. Now, we all know noradrenaline, it increases the BP. It increases the BP. It's a very strong vasopressor drug. So, if it's increasing the BP, what effect will it have on the heart rate? The answer will be less heart rate. Less heart rate. Right? So, this you must know, stimulation of baroreceptors. Some of you may argue, sir, here alpha 1 receptor is also given. Alpha 1 receptor causes vasoconstriction. But if you see between the two options, you only tell me what seems to a better option right now with calm and cool mind. Obviously, I'm sure you will agree baroreceptor reflex is a better answer. That's why the heart rate is reducing. Yes, who's involved in the baroreceptor process? It is alpha 1 receptor that can cause vasoconstriction. Which of the following is the best antibiotic for a patient having a UTI with ear problems? The patient also has history of penicillin allergy. Now, basically, the moment I get to read the word that there is penicillin allergy in this patient, that's the buzzword. You must know you cannot use the other beta lactams. Example, if you see amoxicillin cannot be used. Cefixime, cephalosporin cannot be used because they are beta lactams. Now, I'm left out with azithromycin and ciprofloxacin. Guys, we have said for UTIs, floxacins are very famous drugs, Norflox, ciproflox, etc. Azithromycin is not a famous drug for this. Azithro is more better for respiratory infections. Since they mention UTI, even though in penicillin allergy, I can use azithro also as well as cipro also. But because they mention UTI word, the best answer in my opinion will be ciprofloxacin. A question anticipated just recently in the series, I'm sure you guys may remember. This is the question we talked about. The patient is having penicillin allergy. I asked you which drug can be used. Next, a young lady presents with complaints of palpitations and dizziness. ECG shows absent P waves and irregular RR interval. The BP of the patient was found to be 80/60. That means this person is hemodynamically unstable. Doctor Saab, many people actually, sent me this query. That's the reason I'm including this. Otherwise, this is a medicine question. Because the three options were drugs, they thought it's pharma. Okay, so understand this. The best answer here is cardioversion. Okay, because the patient is hemodynamically unstable, etc. Basically, I should go for cardioversion. Again, this opinion you should take from the medicine faculty, not from me. Okay, just because drugs are mentioned in the option, it's not a pharma question. Because many people wanted a clarity on this, I'm giving you this option. That's it. Okay, patient presented with chest pain, describing it as squeezing. He also describes tightness in the chest. His current BP is so and so, 80/50. Which is the best route for this patient right now? See, the students directly wrote the answer. They said, sir, something with the nitroglycerin was given, so we chose that. And they said some routes were also given in the option. Most likely the patient is in the hospital, so we might have given IV nitroglycerin. Okay, now the BP is less, so be careful. Do not give the IV route fast. Usually the way we give it, it will be slow infusion. Okay, I don't know if this was given in the option. If this was, then this is the best answer. Indomethacin and ACE inhibitor should not be used together due to the risk. So there's a misprint in the question. Should not be used together due to the risk of. All right. So this is a question that seems to be little out of the blue. Sir, the correct answer for this will be hyperkalemia. Usually when a question is asked with NSAIDs and some other drugs, they ask diuretics. Okay. NSAIDs and diuretics should not be given together because NSAIDs reduce the effect of diuretics. ACE inhibitors are the drugs called RAS blockers. And there is a clear-cut statement in our notes where I told you all RAS blockers have risk of hyperkalemia. NSAIDs also can actually cause hyperkalemia. So combination of both drugs, that's the way we have to choose this. Okay. Now, definitely this is a question that is out of the blue, this I can tell you. But if you chose this, we have 25% chance of getting a correct answer even by fluke. So next, just one-liners. I could not gather the options. Treatment of acne. Please remember this was given in the option isotretinoin. This is the drug that we should use for this. It's a very common thing, acne. I'm sure most of you picked up the right answer only. So like that, I've received some more questions also. I'm not even including even this acne, etc. Just because students asked me, I'm discussing this here. Otherwise, pure pharma questions that you saw, they were roughly 20 and above. Okay. Now, there was one more question. Some students told me that they gave a case of a proteinuria and they asked a treatment. So whatever it is, nephrotic syndrome, I don't know the value that was given. So we give steroids in that. If that was given in the option, then steroids become a correct answer. Another question that seemed to be given was hypercalcemia. Please fill me in if you remember the options. If diuretics were given, then I'll choose the answer as loop diuretics. They are actually used in the treatment of hypercalcemia. Other drugs we can use, you can keep in mind bisphosphonates. Bisphosphonates, even they can be used. They are the drugs having dronate in the name. Okay. Now I understand definitely this time paper 1 was difficult as many of you told, but see, every paper, when you say difficult, it can be more number of questions were difficult, but there will be a fair number of questions which are doable. Okay, so even in pharma, some were doable, some were difficult. I agree on that, but that's how the exam is. We need to be prepared for the worst and go for the examination. So irrespective, wishing you all the very best. One thing is, do not get scared or anything looking at the recalls. Recalls are only there to help the future batches, as I'm telling you. Don't count, I got this correct, I got this wrong, because things can't be unchanged in that. Sometimes two words that are given in the question may change the answer. If student don't tell us those two words, our answer may be different, the real answer may be different, right? So please get an idea. This is just for us. Again, as I told you, that will help in the upcoming batches. And we all will get an idea like whatever the topics that are being constantly tested in our exam. So thank you once again, for helping me compile this. And thank you for listening. Please help me in the comments, whatever the things that you're able to recall. Wishing you all the very best. And I really hope that you, if you're watching this recalls or any important question next time, it should be for the preparation of NEET PG and not for the FMG. Okay, best wishes. I'm waiting for the messages from all of you that yes sir, I have made it, I have passed this exam. That's my Instagram ID that you can see over there, right? Just message me over there, I'll be more than happy. Take care everybody, bye bye.